So I was asked a really interesting question the other day, which is like to be in such a vulnerable medical condition and to require neurosurgery and then to have to travel out of country for that, like what was that like? And what I realized is it brought up a bunch of other questions and thoughts for me, which is that like for patients like us with cranial cervical atlantoaxial instability and the comorbidities that go along with it, we're grappling to find care. We're often seeing multiple specialists like that are all siloed into different specialties. What works for a lot of different people with certain symptoms that might even be similar to us doesn't work for us. Then we're getting passed on from specialist to specialist. It's confusing because a lot of us, because of brainstem and vagus nerve compression, it affects multiple systems in our body. They don't know what to do with us, and so us lucky ones, we get diagnosed. We find that right person, we find that access point, we access the specialized imaging, we start to get direction. And for me, I'm so fortunate that I was able to, see a very skilled neurosurgeon, have that surgery. But even when I come home, because this condition isn't understood, it's almost like you come back and it doesn't exist. There's no framework for patients like us. There's no expertise for the types of conditions and symptoms and the nuances in which how we need to be supported and dealt with. I realize like a lot of us are falling through a lot of major gaps and cracks, and that we need this condition to be known, understood, and diagnosed, but also studied. Because what is it like for a patient who has less severe neurological symptoms before intervention? What is it like for another patient like myself who had 14 years of a lot of complexities happening at once? Where should a patient be post surgically when they go into it with paralysis and brain injury and all of this, like, and where they come out, like there's so many different factors. And especially with complex neurology, like we all come in with a lot of parallels, but a lot of differences. And we're at a real loss when we're trying to figure out an action plan, and we're trying to figure out because we are already complex. And it's so tricky within the medical system too, because even if your condition is known, if you have complexity and a lot of layers at once, it can be a lot for your medical professional to kind of place it all together and know how to figure out that combination. It's much easier when you're perfectly healthy and you have one specific thing. You have a heart condition, or you have a migraine condition, or you have a neurological condition. But when you have all of these things happening at once, it's hard enough for that specialist who understands your condition, let alone when you're dealing with something like this. It's unknown, it's not studied, it's not followed, and it's so important that this awareness happens, because we're all going to have different parallels, but we're also going to be different cohorts. And it's so difficult to be in a system where I don't know where to land because there isn't somebody with that knowledge base. And what we really need is a lot of people with that knowledge base, a lot of people to be listening and understanding and doing that detective work, where there starts to be these paper trails for what it's like, not just to have a problem and damage at your cranial cervical junction, not just to have brainstem compression, blood flow problems, all of that, but what's it like for somebody whose body's been adapting for years with this being unknown and untreated? We're kind of pioneers in this. We're kind of out on our own where there aren't a lot of examples. We're just trying to figure it out. But I think the more we talk about it, the more there's awareness, the more physicians that this is on their radar. It's so important. For some of us, it's going to be function saving and life saving. For others of us, it's going to help take out some of the sting of the crazy making. And for other people too, it's going to mean interventions, far less invasive interventions sooner, protecting those neurological structures. So it's really important.